Introduction. Adulthood is not immune to the aftereffects of childhood trauma, which frequently take many different forms. People who have experienced trauma in the past may suffer from trust issues, abandonment anxiety, or trouble controlling their emotions. They might display clinging, relationship avoidance, or maladaptive coping mechanisms. These are not just side effects, rather, they are deeply rooted reactions that have the potential to affect the stability and quality of adult relationships. Studies demonstrate how childhood trauma can impact one's expectations of others and one's own self-worth. Trauma survivors frequently struggle with feelings of vulnerability or unworthiness, which can distort how they view relationships and result in unhealthy routines.
Hey, welcome back guys. So today I will talk about the influence of childhood trauma on adult relationship, and this video for my assignment purpose. So first of all, I will introduce myself. I am Mugilan Subramaniam and I'm doing my bachelor in law enforcement, and I'm a student from New Era University College. Now I told you why I choose this specific topic, because it is a big issue in our society, and this is a major issue in our country also. So the reason I choose this topic, because childhood trauma significantly impact adult relationship, affecting emotional growth, attachment types, and interpersonal relationship. So understanding this can help individual recognize and address underlying issues, leading to healthier, more satisfying adult relationship. It also raises awareness among educated and the public also. Okay, we will move to the next slide. So next slide based on the research objective. So I have three main research objective in my assignment. So the first one is to examine the specific type of childhood trauma and their impact on relationship patterns. The second one is to investigate the mediating role of mental health in the relationship between childhood trauma and adult relationship. The third one is to identify protective factors to intervention of mitigate the negative effect of childhood trauma on adult relationship. Okay, so we roll to the next slide. So next slide based on trauma and emotional regulation in relationship. So in that we will see about childhood trauma can significantly impact an individual's ability to regulate emotions, which is crucial to relationship functioning. So research by Gross 2002 and Wonderkoff 2005 highlight how trauma affect an emotion regulation, with resilient individuals often struggling to control emotions and exhibiting increased emotional reactivity. So this can lead to dysfunction relationship, as the absence of the stable attachment basis often worsen these emotional problems. Therefore, it's essential for individual to develop adaptive emotion regulation strategies influenced by early relation content. Okay, so now we will see the real-time incident based on childhood trauma on adult relationship. Actually, here I have a lot of incident based on childhood trauma, but why I chose this specific incident, because of this incident gave me a lot of lessons for me. So that's why I choose this topic, this incident. So the incident based on Emily, a 32 years old woman who experienced emotional neglect and instability as a child, highlight the impact of childhood trauma on adult relationship. Her parents' emotionally distance and unresponsiveness left her feelings inadequate and unloved, affecting her self-perception and interpersonal dynamic. Despite entering multiple romantic relationships, Emily faced recurring problems such as miscommunication, distrust, and discontent. Her fear of rejection and abandonment led her to push a partner away or cling to them essentially, creating an unstable cycle. When she began dating James is his boyfriend, so who was emotionally stable and supportive. Emily's trauma caused her to view James' behavior as a sign of abandonment. This case highlights the lasting impact of untreated childhood trauma on adult relationship. Even when people are combined to establish healthy relationship. Okay, now we reached the end of my slide. That is small advice from my side. Okay, the advice is, if you have any childhood incident or childhood trauma, you better talk with your parents or your friends, because they are the best medicine in your life to outcome from the incident. And better you consult any psychologist or any doctors or any counseling person related to your incident, so they can give better solution to prevent your childhood trauma. And you also can live your life better way.